Alright, so in this video, all credits go to Biodigital Human, a Creative Commons software. It's a great software system to use if you want to explore the human body. In this video, what I'm doing is, the purpose of a Creative Commons type of software is to build upon what they have already used and to continue your research just using the model that they have, and it's a teaching tool. So what I'm trying to show is that the hypothalamic-pituitary is very important in the endocrine system, and there's a lot of not many people can visualize where it actually is. So that's my main goal, is getting that effectively out there, where the hypothalamic-pituitary is. So we're going to dig into the brain and see where it's located. So I'm taking off the skull. Here's the cerebrum, okay? The cerebrum's right here. We're taking off the cerebrum because it's very centered, okay? It's very, very centered. So we take off the cerebral lobes. Then we go down, and I'm going to get single pick. We're going to go further here. It's not here, but I want to recenter myself. So there's the pons, basically. And we see where the occipital foramen would be, right here. That hole from which the atlas and the axis can be found. So that's very important, because that's where you have the occipital bone that I think attaches to the atlas and the axis somehow, some way. And we see something right here. So here is the pituitary. The hypothalamic pituitary would be around this region right here. Right here, we have the optic chiasm, which is also very important for cranial nerve functions and things like that. Right here is the left optic nerve, the right optic nerve, another cranial nerve that's involved in sight. We have a few other cranial nerves around here that are involved for the lateral, inferior, and oblique muscle movement. But one other cranial nerve I want to identify is the trigeminal ganglion, or trigeminal cranial nerve. And it branches into the three branches: the ophthalmic, the mandibular. Well, here's the maxillary. Here's I think the mandibular. Hence trigeminal. So here's the pituitary gland. We have the adenohyphosis and the neurohyphosis. The pars distalis, the pars nervosa, or the anterior pituitary and posterior pituitary. And some secretions of the anterior and posterior pituitary would be prolactin inhibiting hormone. Some might be hypothalamic, some might be pituitary based. Some that are involved with ACTH and things like that. But they're mainly responsible for positive and negative feedback loops, the hypothalamic pituitary. So that is just an example of where the hypothalamic pituitary is located and how it's important for positive and negative feedback loops. Thank you. All credits will be given to Biodigital Human. Thank you.